Hi, Dr. Shaw. It's a pleasure to meet you. I also have a PhD, so if you don't mind, I'm going to just take a few minutes. So you and I, neither of our doctorates are in immunology or infectious disease. So I just feel like that's an important place to start. Would you mind just for as briefly as you can, explaining what the peer review publication process is like to establish credibility as an expert in a topic?
Well, peer review process is the way one judges a paper that's submitted to a journal or a book, and it can be very rigorous, and it basically involves scholars, but not necessarily people in a particular science field, submitting a manuscript that, if the editor chooses, goes out for a review process. And usually there are two, sometimes even three or four reviewers that have a look at the paper. They discuss amongst themselves and with the editor the scientific merits and demerits of the paper, and then the editor comes to a decision. And the decision can be the paper is acceptable as it is, which is rare, or it needs revisions, and the reviewers will provide sometimes lengthy lists of critiques that have to be addressed. And once those have been done, if the editor is satisfied that you've addressed the critiques, the paper is then considered to be in press and is going to be published. And so that, in a nutshell, is how the process works.
So I appreciate your sharing of that description. So in essence, you would agree with me in saying that someone who has credible expertise on a specific topic would have papers published in peer-reviewed journals related to that expertise. Is that true?
That would largely be true, yes.
And do you feel like, in general, people whose work is credible and well respected in their fields of expertise, it tends to get published in high impact journals?
Well, that's a little tougher question, and the reason is because high impact journals are not necessarily the best journals, and the reason for that is there's sometimes monetary restrictions that go into publishing a paper, let's say in Science or Nature. Other journals really kind of become the house journals of certain associations, such as the American Academy of Pediatrics.
Who have relatively high impact factors. I'm in the field of nutritional sciences, so of course those impact factors feel
absolutely
years ahead.
And that's true. And so you have this ranking of journals based on their impact factor, and there is some credibility to that, but sometimes I think it gets overused. I think, frankly, let's say you have a new journal that's just starting out. It may have a very low impact factor because no one's heard of it. That doesn't mean it's not a good journal.
Certainly, that's true. And also, we have this sort of really risky thing in the academic sector right now, these predatory journals that are fake and are sending folks information saying, hey, we know you, you're the expert, come publish here. But by and large, I would say people with a lot of credibility in the scientific community are aware of predatory journals and sort of judicious about publishing for solicitation. So while we were here, I've been sort of trying to figure out, your expertise, because this is out of my scope. And I've been trying to spend a lot of time in the last week or so, familiarizing myself with what is the really most credible science on this topic in this day and age, particularly the type of science that's designed in a way that it can influence policy. And so I would just like to ask you, in moving forward in the conversations that you have, to consider that you are making very spurious claims. And I just would like to tell my colleagues what that means. So I can say that by and large, two factors are associated, right? Like, we know that in the summer, rates of murder are higher. Guess what else is also higher? Sales of ice cream. Sales of ice cream and murder rates have nothing to do with each other. We call those spurious correlations. And so I think that many of the things that Dr. Shaw has been sharing are overstatements of his understanding of the science in a field that I think treads outside of his own. So I would just ask you to please, sir, be very careful. We're in a global pandemic. Our healthcare system and infrastructure could not possibly withstand a blow of a vaccine preventable illness spreading by and large in the community. And I think we have to be judicious about how we throw around our credentials to establish credibility, particularly when we're using science in a way that overstates things that are not well established in the scientific community. And we say, and this is my opinion, following summary of scientific literature, because many of the things you shared, you said, and this is my opinion. And I think that is dangerous in the scientific community when we use our credentials to establish ourselves on authorities of things that we are not the authority of. And I don't need a response, sir, but thank you so much for your time. I really appreciate your lending your time and your ear to us. Thank you.